Hi, my name is Rochelle Franklin, and I'm going to be performing the video for gas exchange today. First, we're going to start off with hand hygiene. Of course, before we want to see our patient, we want to perform hand hygiene for at least 20 seconds before entering the room and exiting the room. All right, so now we're going into the other room where our patient is. Hi, Mr. Reeves. My name is Rochelle Franklin. I'll be your nurse today. Can you tell me your full name and date of birth?
Kyle Reeves, September 21st, 1998.
Perfect. Okay. So, Mr. Reeves, your mom was telling me a little bit about what's been going on. Sounds like you have a cough and some shortness of breath. Can you elaborate on some of those?
Yes, I cough fairly often through the day, and I do have shortness of breath, and it feels heavy on my chest.
Yeah. Have you done anything to try and help with any of those symptoms at home?
I take hot showers, and sometimes I'll take some cough medicine.
Okay. Is the cough medicine helping with your shortness of breath?
Not really,
No. Or the
no.
congestion at all?
It helps a little bit with the
Yeah.
congestion and the coughing,
And the
yes.
coughing, and I'm assuming that you're coughing up some mucus, correct?
Yes.
Okay. All right. And then also, how long has this been going on for?
It's been going on for quite a while, and I'd say maybe less than a year, but
Less
a
than a
while,
year?
yeah.
Okay. So about 6 months, less
Yeah.
than a year? Okay. All right. So Mr. Reeves is telling us that there's a productive cough, there's some shortness of breath, the medicine's not really helping, doing some non-medication treatment as well with the hot showers. That's also not helping. And so next we are going to move on to the objective for Mr. Reeves, and that includes the blood pressure. So I already took Mr. Reeves' blood pressure earlier, and it was 128/89. So we're in the good zone. We're happy with the blood pressure. A little bit high on the pulse. We have 100 beats per minute for pulse. And a little low on the SpO2. We're in the 90s, so I will consider asking the doctor or looking at my standard protocols to see if I can put at least 2 liters a minute on Mr. Reeves for that SpO2. And the temperature is a little bit high, so we have 101-degree fever. I'll also ask the doctor about potentially doing some antiemetics to treat that fever. And then respiratory rate was 24, also in the higher range due to the congestion, productive cough, and the shortness of breath. Okay, so next we're going to start our other part of our objectives. So I'm going to be observing Mr. Reeves' chest, making sure that both sides are symmetrical with the rise and fall of the chest. Usually you do this when you're counting respirations as well. And see if there's any accessory muscle usage, any striations, use of like clavicle breathing, that, real big struggle to breathe there. And a little bit of labored breathing due to the shortness of breath. All right, so I'm going to have you stand up, Mr. Reeves. We're going to perform our stethoscope. So you always want to perform this on bare skin, but for video purposes, we're going to leave clothing on. I'm going to start in the middle of the neck to see if there's any stridor. Good job. And then number 1 over here, and we're going to go in a zigzag pattern. Deep breath in. Good job. And then we're going down here. 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 And then we're going to go a little bit lower on that axillary region, okay? And one more. All right, Mr. Reeves. And then I'm going to have you turn around and a couple deep breaths. We're starting up here on Mr. Reeves' left-hand side. And then just breathe in and out. In, out. In. And 2 more, okay? So we're going down to the lower lobes. In, out. And 1 more in, out. Perfect. All right, so around here we're hearing some wheezing, which I did expect. In the lower lobes, we would hear some fine crackles, if not some coarse crackles down here, if we were concerned about that mucus going further down, but definitely some wheezing upon inhalation and exhalation, like Mom had mentioned to me in the beginning. All right, Mr. Reeves, thank you so much for participating in the gas exchange video. Have a wonderful day.